When most people think of rubella or German measles, they just think of a mild 3-day rash. No big deal, right? But behind that seemingly simple symptom is a story of absolutely devastating lifelong impact. Today, we're going to uncover why this virus is so much more than meets the eye.
So that's the big question, isn't it? How can a virus that makes you sick for just a few days be responsible for such profound, lifelong damage? Well, the answer lies in a critical secret hidden deep within its biology.
All right, first things first, let's get properly introduced to the microbe that's causing all this trouble, the rubella virus itself.
So, rubella is part of the toga virus family. It's what we call an enveloped virus, and its genetic code is a single strand of positive sense RNA. And that structure, well, that's what allows it to so brilliantly hijack our cell's own machinery to make copies of itself. It's incredibly efficient.
Now, here's a really interesting tidbit. Humans are its one and only natural host. That's right, it doesn't live in animals, it's not carried by insects, it circulates exclusively within the human population. And that's a super important detail when you start thinking about how to control it.
So, how does this human-only virus actually get around? How does it travel from person to person and really establish a foothold in the body?
Okay, so its journey kicks off with transmission. An infected person coughs or sneezes, and you inhale these tiny respiratory droplets. That's step one. From there, the virus sets up shop, first replicating in the back of your nose and throat and in the nearby lymph nodes. And then, it makes its big move. It launches a full-scale invasion by entering the bloodstream, a state we call viremia, which lets it travel literally everywhere in the body.
So, once the virus has spread all over, what does getting sick with rubella actually look and feel like? Well, for most people, especially kids, it's actually a pretty mild experience.
The whole thing happens pretty fast. You've got about a 2-week incubation period where nothing seems to be happening. Then you get a brief fever, maybe feel a little crummy, and then boom, the classic rash shows up. But the key thing to notice here is just how quickly it's all over. The rash itself, it's usually gone in just 3 days.
So the main things you'd see are that mild fever and a rash of flat red spots that usually starts on the face and works its way down. But the real dead giveaway for rubella, the classic sign, is the swelling of the lymph nodes right behind the ears. For adults, and especially for women, you might also get some pretty significant joint pain.
And this brings us right back to that big question we started with. If it's usually just a short, mild illness with a 3-day rash, why on earth is it considered such a major public health threat? Why have we put so much effort into wiping it out?
Okay, this is where this story takes a really dark and serious turn. Because the true danger of rubella isn't about the person who gets the rash. It's about what the virus can do when it infects a pregnant woman.
This, right here, is the devastating secret. The virus can cross the placental barrier. Remember that viremia stage, when it's in the bloodstream? Well, it can travel from the mother directly into the developing fetus. And this is absolutely catastrophic during the first trimester, when all of the baby's major organs are just starting to form.
This infection of the fetus leads to an absolutely heartbreaking condition known as Congenital Rubella Syndrome, or CRS. And for the baby, this isn't just a rash. We're talking about a collection of severe, widespread, and permanent birth defects caused directly by the virus.
What often happens is this classic triad of terrible birth defects. The virus attacks the developing eyes, causing cataracts. It damages the tiny forming heart, leading to serious structural problems. And just tragically, it attacks the brain, causing deafness and lifelong intellectual disabilities. So, a 3-day rash for the mother can mean a lifetime of profound challenges for her child. So you're faced with this devastating outcome from a virus that has no cure. What do? How do you possibly fight back? Well, this is where the story of public health becomes incredibly powerful.
Just take a look at this. It really puts everything into perspective. On one side, you have treatment. And the simple fact is, there is no antiviral therapy for rubella. Once you're infected, that's it. But on the other side, we have prevention. We have a highly effective, live attenuated vaccine. You know it as part of the MMR shot that can stop this virus dead in its tracks.
And wow, what a success story this has been. This number says it all. Back in 2005, the CDC was able to declare that because of widespread, successful vaccination programs, rubella had been officially eliminated from the United States. That's a massive public health triumph that has prevented countless cases of CRS.
And this final thought really brings everything into focus. The true identity of the rubella virus isn't some mild childhood sickness.
Its real, terrifying significance is its role as a teratogen, an agent that causes birth defects. It's the ultimate proof that sometimes the biggest dangers really do come in the mildest packages.